I think what has happened in the past 2-3 decades is that people have lost the historical perspective. People don't remember or don't have the experience of things long past, when people didn't have equal access to a good health medical system, where it was dependent on your purse, how good service you got.
Well, I was born in a comfortable home. My parents could afford to provide treatment. I had my appendix out in a private clinic in London. But of course, I was aware, because of my political interests, that there was no health provision for the majority of people.
Suppose your wife falls ill suddenly.
But my woman never is ill. Strong as a blooming horse she is.
We mothers can't afford to be ill. I'm not insured.
I don't think Churchill really wanted any social reforms at all, but I think the rest of the cabinet understood better than he did, the wartime cabinet, that people had to be given a vision of something worth fighting for.
The nightly siege of London has begun. The city is dressed for battle.
We had a mix of charitable hospitals, private sector hospitals. That model collapsed during the war. It was unable to deliver healthcare. At the end of the war, 50% or so of the population could not afford to access healthcare when they needed it.
That was a bomb.
The idea of the NHS was really born during the Second World War. Churchill wanted people to feel that they were fighting for a better future.
It was not enough just to say Hitler is an evil person. They had to feel that they were fighting for something for themselves. So Sir William Beveridge, a Liberal, not a Socialist, was asked to prepare a report.
The Beveridge report in 1943 was really investigating how society could be better after the war, and universal healthcare coverage within a National Health Service was the main idea.
My plan for social security in Britain is to expand and combine our existing separate schemes of social insurance into one comprehensive scheme.
If everybody is insured, then you don't need insurance. If everybody is paying taxes, the people who have the misfortune to be sick are supported by everybody else, and you don't need to have individual insurance.
And it was enormous success, really.
The government have announced their plans to establish a national health service so that everyone may be provided with up-to-date medical care.
Within a few weeks, the sales of this government report, very thick and boring, were the biggest sales that there had ever been of a government document, either before then or since then. People were very excited about it. I think they thought, we want a society where people help each other when they're in trouble. We wanted a society of solidarity.
Dr. Paul Joseph Goebbels said recently that the nightly air raids have had a terrific effect upon the morale of the people of London. The good doctor is absolutely right. Today the morale of the people is higher than ever before. They are fused together, not by fear, but by a surging spirit of courage the like of which the world has never known.
Just as in wartime, if it has to be done, it has to be done. We've got to meet the needs of peace with the same determination, and we were bankrupt when we set it up, but we said the health of the nation is as important as the security of the nation.